I'm Edwin Warfield, the publisher of City Biz, and I'm honored today to interview Dr. Michael Koehler, who's the medical director at Affinity Whole Health. Welcome, Michael.
Thank you so much, Edwin, for having me. I appreciate it.
So, you're the medical director at Affinity Whole Health. Tell us about Affinity Whole Health and your role there.
Sure. So, Affinity Whole Health is a clinic that specializes on wellness and health for our patients. We really focus on optimizing hormones for our patients, as well as helping them with their weight loss journeys for patients who want to lose weight. Patients come to us just to, live better and healthier lives. I'm the medical director of Affinity Whole Health, and that means that it's really my job to oversee the latest therapeutics and medications that we can offer to our patients to help them achieve their goals, and also supervise the physician assistants and nurse practitioners that we have.
And how many locations does Affinity Whole Health have?
We currently have 4 locations. So we've been in Ohio for over a decade. We have an office in Cleveland and also one in Columbus. We opened up an office in Indianapolis 2 years ago, and we actually just opened up another clinic last year outside of Chicago.
And so, what are some of the factors driving the semaglutide craze?
There's a craze. I like that term that you use, craze, but it's for really good reason. I mean, these medications, in terms of weight loss, are groundbreaking medications. They work very well, and they're not like it's like a supplement that just came out that people are taking and losing weight. I mean, these are medications that, number one, they've been researched for years. They're not new. They were just approved, for diabetics initially several years ago, and then a few years ago for weight loss. There have been so much good data on these medications, and the fact that they work so well for weight loss is really what's driving the craze about them.
And how are you helping your patients navigate the risk?
So the risks of these medications, interestingly, they're quite safe. I think most commonly the gastrointestinal side effects that they can cause, nausea, constipation, etc. They're actually usually pretty minimal, and it really has to do with the dose. And I think with our experience with these medications, tinkering and finding the correct dose for the patient is the most important thing, because we want them to be on a dose that, number one, is effective and helps them lose weight, but you also want to be on a dose that doesn't cause them any adverse effects, which are quite minimal.
And how are you helping them overcome the stigma associated with testosterone therapy?
Unfortunately, testosterone has been abused for decades, mainly in the fitness industry. But fortunately, we know from very good data that patients who aren't just looking for improved athletic performance, these are people who have low energy, fatigue, sex drive or libido issues. I mean, can get erectile dysfunction, really just an overall decreased sense of well-being and depressed mood. These can all be symptoms of testosterone deficiency. And we know that if you get a patient's testosterone levels optimized, that can really help with those symptoms.
And so, what role, everyone is using telehealth. How are you integrating telehealth into your practice?
Everyone loves telehealth. Patients love telehealth because it's just much more convenient. For the initial interaction, typically a patient will come into the office and they can visit us in person and make sure that we are in office so they can get to. They can meet their provider as well, and also their patient care coordinator. And usually follow-up visits after that are predominantly telehealth, and that's just from a convenience perspective.
Yeah, it's a wonderful advancement. So, tell us about the role of your patient care coordinators and how that distinguishes your practice from others in your space.
I'm glad you mentioned them because they are a core to our clinic. And, you mentioned that they're definitely, most clinics don't offer this kind of personalization. Every patient, whether they're on a hormone program with us, whether they're on a weight loss program or both, they have a dedicated patient care coordinator that helps us achieve really the highest level of service and communication. These patient care coordinators are working, shoulder to shoulder with our providers in the clinics every day, and they're real people. So if a patient ever needs to reach out to the patient care coordinator for any questions or concerns, they can text them, email them, or even call them, whatever they want.
So, Affinity recently announced several patient care enhancements, integrating new technologies and techniques into the practice. Can you just tell us about these?
Absolutely. So, the first thing that we've done recently, which we're really excited to launch, is our new website. It just went live last month. And it not only is it much more information for patients, but also there's a portal for our patients to log into where they can set their appointments. etc. And it just makes it a lot easier for patients to get their information. We also recently have developed, we're able to get fixed dose pens for these GLP-1 medications for weight loss. And, like I mentioned before, everyone responds to a different dose. For patients who require higher doses of the medications, which some do, these fixed dose pens are a lot easier for them to use and also better economically as well.
So, is there any part of your personal journey or your corporate journey that you'd like to share with us that you haven't shared with us?
I think in terms of my personal journey, I've been a testosterone patient, so I know the benefits of these medications, and they can really be life changing if you qualify for them. Not everyone needs to be on hormone therapy, obviously, but if you're having any of the symptoms, low energy levels, fatigue, libido issues, loss of muscle mass, increasing fat, and you're trying to do everything right and you just don't feel great, you should reach out to us and really have a lab panel checked. I mean, we'll check in a big comprehensive metabolic panel on you, including all your hormones, and really see if you could benefit from any of the therapeutics that we offer. And I know because I'm a patient, so I totally appreciate the benefits of hormone optimization.
Well, Michael, thank you for sharing your story, and keep us apprised as your practice grows and there are new therapies that you want to introduce us to. Again, thank you for your time.
Thank you so much, Edwin. I really appreciate it. Thanks for having me on.